So we learned a lot of information here. The worst part that I really saw is really this range of motion and rotation, right and left, which really tell me C4, C5, bring in nerve 11, the SCM, and the tract. So I always begin by resetting the nerve. So I like to come in on infrared, and I'm going to come right into the anterior cervical. Now the laser, you need to tell me if this gets a little bit warm. If it gets a little bit warm, because it is a class 3, you can produce a little bit of heat. Very rare though, but we need to ask. You're usually going to see this in lighter skin and darker skin patients. So I start with about 20 seconds of infrared and 20 seconds of red. So it only takes about 40, 50, 60 seconds to really get this nerve to fire. So what am I looking to do? I'm looking to improve the strength. I'm looking to change the range of motion. How am I doing that? I'm using the laser to stimulate the nerve and the cells to fire what we call the mitochondrial DNA. It's the mitochondrial DNA which creates the ATP, and the ATP is what allows the muscle to contract, but also to relax. Once I reset the nerve, then we're going to get better range of motion. So right now, because of the inflammation, I'm using the inflammation frequency right now, is that nerve is being compressed. And so it's sort of like being your cell phone, instead of being on 5 bars, is only on 1 bar. Does that make sense? So after that, we want to get the inflammation out. We want to raise that nerve because you can't have healing or immunology without the neurology. So this is really, really important for us. All right? Now I'm coming here. Because you have both sides, I'm also going to do it on the other side. Now, you tell me if you feel it. Now, while I'm doing this, I should feel her neck start to relax. And I'm on a nice trigger point here, aren't I? Now I'm trying to be really light, so now I can be doing multiple things. I can be stimulating the nerves as well as working on the neck muscles, working on the trigger points, and trying to get this inflammation out. So inflammation is the bad boy. We know we have inflammation pretty much systemically with you. Would you agree to that?
Yes.
That your whole body is inflamed?
Yes.
And so that's making her more hypersensitive to pain. So her pain threshold is really close, and we're going to try to reduce that. So here we're going there. All right, nice. So I just let it relax, so let the laser do its work. Now we're going to do some things as far as rotation. I'm going to come to the back of the neck, and I'm going to switch to muscle activation. So I'm turning it, I'm setting it from inflammation to muscle activation. I'm going to go infrared right there. And now what I want you to do is I'm going to paint the area, starting with a good area first, and I want you with your nose to try to make little figure 8s like this with the tip of your nose. Little figure 8, 5 one way and 5 the other way.
With my finger?
Nope, with your nose, the tip of your nose. Pretend there's like a pencil on there.
Okay.
And I'm sorry, I'm not in front to show you.
Okay.
Now it's going to be easier one way than the other.
Okay.
You want to check real
Okay,
quick?
so
And then I'll work with you
Good.
on everything. Just see if they can wait 5
Good.
minutes and I'll get you out.
So 5 one way, and then when you finish that, we're going to go 5 the other way. One way was easier than the other, wasn't it? Yeah. So this is going to be one of the exercises at home, but can you feel this muscles relaxing as we do that? So what this is doing, it's forcing both sides of the muscles to have to work equally. So if I have one side that's too tight, it's forcing the other side to have to work, which naturally inhibits the other.
Okay.
All right. Now, normally I would like to be skin on with the laser, but for the upper extremity, I'm doing pretty good here because I get most of it. In a clinical situation, we're going to try to gown them many times, but for the upper, doing the head and the neck and the TMJ, I'm not too worried about it. But remember, skin and laser is the best combination. And now I want you to start doing some breathing. So what I want you to do is I want you to do big breath in through your nose and hold it. There we go. So what am I trying to redo? I'm trying to reset that phrenic nerve. All at the same time, I'm just lasering the area that's been infected by the trauma. Let it out. Good. I want you to do just a few breathing exercises for me. Super. Couple more. Okay, here we go. Now we're going to do some activation. She's going to do some work. I want her to turn her head slowly to the right for me. Good. And then slowly to the left. Look at the range of motion already coming back. Can you feel that? Much better, isn't it? So we can see range of motion. Haven't really done any work yet. Come to the right for me. And to the left, that's where we're having the problems. When we turned her head to the left, she went to the right. So I like that. I like to see that because that's going to be one of the things we check. So now I want you to shrug your shoulders. Shrug your shoulders for me. Hold, don't let me push down. So what am I doing? Let it relax. Now I'm doing a combination of two different muscles controlled by one nerve called the spinal accessory nerve. All right, so bring your shoulders up. Turn your head to the right for me. Good. And let it relax. Head forward, straight, just straight. Shrug your shoulders and turn to the left. There we go. Love it. Relax. Shrug your shoulders for me again and turn to the right. Shrug your shoulders. There we go. Hold it there. Hold it there for me. So I do a little bit of activation. Let it relax now. Just you relax for a second, okay? Now, she's gone through a lot. So I really can only do 2 or 3 exercises at a time before she's actually going to fatigue. So you will see this when we do some of the eye. Now, when she moves that, I can feel a little bit more range of motion here in the shoulder, but I also feel a little bit of popping and clicking. Popping and clicking for sure. How you feeling? A little nauseous, okay. So she's a little nauseous, so what did I say? She's so close to threshold that we have to go slow. We have to go really slow, okay? The nauseous center is right next to the one that does the SCM when we did the head turning and the other thing. That's the SCM, that's cranial nerve 11. Guess what's right above it? Cranial nerve 10, which is the nauseous center, okay? So we're trying to get that breathing back. We're trying to do that. But when they say that they're nauseous, we're going to stop. Okay? So that's what we're going to